To start off, I want to put everybody sort of in a specific situation. I want you to think about your own pain experience to start off. So with that, I want you to imagine that you've decided to take a trip to a country where you don't speak the language. Maybe you've learned a few expressions and words to help you get around, but that's all you know. And you get there, and that night in the hotel room, you wake up at 3 a.m. with a horrible pain in your side. And you're Googling, you're looking on WebMD, you're starting to freak out, you're thinking, this is a big problem, I've got to get to a hospital, something bad is going on. And so you make it to the hospital, and now you're having this conversation with someone who can't understand you very well. You're trying to explain to them what's been going on, what you're feeling, if there's been any changes in your diet, any kind of things going on with you over the last few days. All the while, this medical professional is trying to figure out as well what's going on with you by looking at nonverbal signs. So your changes in posture, you're grabbing your side, they're pushing on different parts of you, you're wincing, your facial expression is changing, you're sweating. It's very clear that you're distressed, but it's really hard to communicate exactly what's going on. So when we talk about how we evaluate, how we think about how people with autism express or experience and express pain, we really need to think about how, even ourselves, how we communicate pain, and how that's actually a very difficult task for each and every one of us. And so what does this mean for people with autism? Well, we've been really fortunate to have a number of people coming through our lab and adults with autism who are participating in our pain studies. And we really started by just having a structured interview and asking questions about their pain experience, because there's not a lot of evidence or understanding of what the pain experience is like for people with autism. So I think one of the things that someone said to us first, they were describing going in for a knee surgery. And they said the doctor's words to describe pain are too abstract. And so they were having a lot of difficulty understanding things like, what did it mean when they're describing dull versus sharp pain, or burning versus stinging pain, and those sort of words that are very metaphoric were very difficult for this person to describe and work with their doctor. Someone else said, if I was in pain and people were in the room, I would not tell them. Because for this person, it was a very social experience, having to describe their pain to someone else, and then having that person then try to sort of come closer, figure out what's going on, and that interaction was too difficult for that person. And so they weren't going to initiate that interaction. Someone else, I think, really summed it up well, that it's a decision. I won't go to the doctor unless the relief from pain will outweigh the sensory overload and anxiety from going. So weighing out those options and deciding when they were going to get medical treatment was a very difficult decision for this person. And I think that sort of illustrates some of the things we think about, especially with adults with autism, is how they're going to seek and get treatment for pain-related conditions. So what do we know? If you're communicating pain differently, what might happen? What might you be at risk for? So we know that we see increased chronic pain conditions, some of the stuff we've talked about with GI distress and things like that, constipation. Those can all be very painful conditions. We also see increased ER visits, like we heard in the introduction, where they're related to injuries and accidents. So we need to be able to assess, we need to be able to manage people with autism's pain. We also know that there's a large percentage of people who have self-injurious behaviors. And so I think in the past, people have made this assumption that it's really an indifference to pain. But I don't think, as with anything in autism, it's that clear. I don't think we can just ask, are people with autism more or less sensitive to pain? And so what I think we need to do is start looking at really rigorous scientific studies across the whole pain experience and thinking about this in different contexts. Each and every one of us experiences pain in a very different way depending on the context. So in the literature, what we've seen so far is that if we look at very brief, acute, painful events like a needle stick, we see that in people with autism, they'll have increased nonverbal signs of pain, things like facial expression changes, heart rate changes, that will be elevated and last a lot longer after the event, as well as reduced self-report. They will not report that they're in that much pain, even though we're seeing these increase in nonverbal pain-related expressions. So I think that really illustrates the fact that there's some disconnect or that we just really don't understand all the sort of expressions of pain in people with autism. So I'll tell you about some of the work that we're doing to try and understand this whole pain experience and maybe illustrate some of what's going on. So Alicia and Allison have come down to visit. They've experienced our pain protocol. They're still talking to me. It's not that bad. But it is a difficult thing to recruit and get people interested in these types of studies. Not a lot of people willingly want to put themselves in pain, of course. But what we use is a small thermode that heats up to painful temperatures. And it's about 1 inch by 1 inch, and it heats up to just painful for most of the studies that we're doing. And that usually people will sort of describe that as like a really hot tub. So it should just feel a little bit too painful. And so we're doing this all in adults with autism. We're placing this thermode on their leg, and that's what the sort of painful event that we're initiating. Then there's things happening. Your neurons in your leg are sending signals to your brain. There's this integration of all these signals, and then you're making a decision about how you want to express or communicate your pain to us. And in this case, we've got this visual analog scale here that's on a laptop computer screen. They can just scroll back and forth and let us know how painful that temperature was. So in this case, then, we're looking at 2 types of pain, a short and a longer one, 5 seconds versus 21 seconds. If we look at the short initiation of pain, we see there in black, this is the group without autism, that as that temperature is increasing, there's this sort of threshold when then it becomes painful. And it's just mildly painful, a 1 or a 2 out of 10. But you can see in blue there, at even temperatures that are warm, where people without autism are not rating this painful, you're actually seeing that the people with autism are rating this a 1 or a 2 out of 10 on the pain scale. And even at higher temperatures, they're almost double the pain of people without autism. When we look at this at 21 seconds, we're looking at just low heat and high heat. At low heat, we're seeing the same thing that in people without autism, they're not rating this painful. This is not painful to them. But in people with autism, it's maybe a 1 or 2 out of 10. At the high heat, again, it's almost 2 or 3 times as painful for people with autism. So what does this mean? So what we wanted to do is then look in the brain and understand what's happening before they're making this rating, before they have to express their pain. Especially given the sort of communication issues that we expected, we wanted to look at something that would be communication independent. And so we're using functional MRI to look at the brain response during a painful stimulus as this communication independent tool. And so we can do this across that 21 seconds of heat pain and look at the brain response throughout that entire time. During the early stage in people without autism, you can see in the shaded areas in orange and red there that the brain is responding in areas related to sensory and emotional processing really robustly through the whole time that these people are in pain. And this is exactly what we would expect to see, and other studies have shown this as well. In people with autism, however, early on, we're seeing that exact same pattern, but after about 5 to 6 seconds, it's gone. It's just completely diminished. So there's something very, very different about how the brain is processing this painful stimulus in people with autism. What's sort of unfortunate is we really don't know what's going on here, but it really suggests to us that there's a very big difference in how these people are processing pain. And I think what's going to be really critical for us is to understand how that relates to the expression and communication of pain. Clearly, if the brain is responding very differently and we're seeing increased pain reports, we need to understand what that link is. So our current study, that's what we're working on right now. We're also looking at automated facial expression processing to understand what their facial expressions look like during this task. And we're also looking at heart rate as well. So we want to understand all those nonverbal signs of pain, these pain reports, and how they relate to this unique brain response. And I think this is really what we need to understand, is look at this full pain experience. Everything from when the neurons are responding in the leg, what's going on in the periphery, as well as what's happening in the brain and that sort of integration. All of the things you can think about might change your painful experience, the social context, whether you're at the doctor's office or you're out alone in the woods, all these sort of contextual things that we need to think about, and how that might relate to the kinds of expressions and communications that you need to do. And I think that really just illustrates the fact that this, I think, is how we're going to improve pain management and clinical care. By understanding the relationship between all of these things, we can start to identify new tools or which tools might be more accurate or adequate to assess pain in people with autism. So with that, I just want to thank all of our participants. They've really been instrumental in just talking about their pain experience. I think that's been the best thing, is just really understanding from their perspective how it's different, which I think is really going to drive the research from now on. And of course, this is team science, and so I want to thank all of the people at Vanderbilt and our collaborators as well. Thanks.